Grief demands a witness is a phrase that's said by this guy, David Kessler. And I don't know much about him other than he said that. And I've been thinking about that quote a lot. And it's helped me give a little more grace to patients and families that are giving me a hard time. And benign things, right? Think peds patient breaks their arm. They get a cast, 8 weeks, whatever. Maybe they don't even need surgery. And the patient and the family are just letting you have it. They're angry. They are yelling at staff. They're being rude to you. They're not grateful for your care at all. There wasn't even a waiting time in the waiting room, and they're just angry, right? And then if you adjust the context of that a little bit, say they're 17, they're going into their senior year of high school. They're getting scouted by D1 schools for baseball, and now they're out for the season. Give them a little more grace. I think about it in my own family, right? Like if my kid, who's almost 4, if she broke her leg, and if she can't do dance or gymnastics, and we're moving for my attending gig, and now she can't connect with new friends, then she starts preschool. If she couldn't play around in recess and make connections, I would be beside myself. Not for the health of my kid, but you'd grieve what you thought the next 2-3 months would look like. That's a normal human response, right? And that applies to so many other things, right? Like the patient with stage 4 cancer who now is going to die sooner than expected. They can't walk their child down the aisle, things like that. They're not mad at you. They're grieving what they expected their course to be. And I think about that in burnout for healthcare providers, and it's one of the reasons why I think like everyone in emergency medicine, I can only speak from my own field, should probably have a therapist. Because we have grief and exposure to trauma just working in this field. And if grief demands a witness, if you don't witness properly, your patients will be your witness. Your bedside manner can get worse. Your chance of litigation can get higher because grief demands a witness. You are forcing your patients to bear witness to the grief that you're feeling because you're not attributing that grief. You're not expressing it. You're not allowing yourself to feel those things at the appropriate setting. Your patient doesn't have anything to do with your grief. And the thing that I've said more in training, right, when you get that tough patient is, oh, they're just grieving. But that quote's helped me put more context to it. And I think it makes me a better provider because of it. Anyway, 11 more shifts of residency.